May is Stroke Awareness Month, and the importance of watching out for this potentially deadly condition has been highlighted in just the last week. Pennsylvania's Lieutenant Governor and Democratic candidate for Senate, John Fetterman, was sidelined just days before a primary election after suffering a mild stroke. Now, we are happy to welcome Dr. Andre Ferdue of Utica Park Clinic, who is the medical director of the Oklahoma Stroke and Neurological Institute at Hillcrest. Welcome, Dr. Ferdue, and thank you for being here.
Thank you for having me. I appreciate it.
It's a really important topic, I believe.
Yes, it is.
Let's start by talking exactly what is a stroke and what are some of the symptoms that people can look out for when they are noticing signs of somebody having a stroke.
Okay. So a stroke is essentially a disruption of blood flow to the brain. And whether it is due to a blood clot that causes a certain type of stroke called an ischemic stroke, or whether a blood vessel ruptures, which causes another type of stroke called a hemorrhagic stroke. The important thing to keep in mind is that the brain is exquisitely sensitive to a lack of oxygen. It gets that oxygen from blood coming from the heart, so if there's anything that disrupts that, it can possibly cause a stroke.
Absolutely. Are there going to be certain people that are more at risk for a stroke, or, is there a way to know, if that runs in your bloodline, that sort of situation?
Well, there's certain things that always come to mind. Patients that are hypertensive, high blood pressure, have a 4 times higher risk of having a stroke. Patients that are diabetic have a 2 times higher risk of having a stroke. Patients with elevated cholesterol have roughly a 2 times higher risk. Smokers have a 2 times higher risk. So as you can see, as you kind of continue to collect stroke risk factors, your risk of having a stroke goes up significantly compared to someone at the same age and demographic who doesn't have those risk factors.
Absolutely. I know we talked briefly about the symptoms. Can you run us through again just kind of some of those direct things that you can see when you are really noticing that that's happening to somebody? Well,
I think one thing I want to say even before that is that 80% of strokes are preventable, and so people need to keep that in mind. But you want to think about the acronym BFAST. B stands for balance, so a loss of balance, lack of balance, feeling like you're falling to one side. E stands for eyes, so if someone they lose vision in an eye, double vision, blurry vision. F stands for face, so asymmetry of the face. Easy to look at someone's in a mirror or look at their driver's license picture.
Interesting.
A stands for arm weakness, or particularly appendage, because you can have leg weakness also. Arm and leg can be affected. S stands for speech, so if you're unable to generate words, unable to understand speech, or if your speech is slurred. And the last T stands for time. Time is incredibly important. For every minute that the brain is without oxygen, up to 2 million brain cells can be permanently injured.
Wow, really, really good to know. So you have to act fast then to make sure that you are...
Absolutely. You want to be fast in not only recognition of stroke, you want to be fast in getting to the hospital to give us the opportunity to hopefully reverse the symptoms if possible.
Of course. And real quick, we want to talk about treatment options. If you do suffer a stroke, what can you say about that?
Well, those treatment options really depend on when patients come into the hospital. So if someone comes in and within the first 4.5 hours of having a stroke, they may be a candidate for getting IV medication in the bloodstream. That may actually help to dissolve a clot. It's about 40% effective. If patients have a stroke of a large vessel within 24 hours, we do very specialized imaging. If that imaging shows that they're a good candidate, they may be open to possible mechanical thrombectomy. For patients who come in outside of the window, we have more secondary management, which is mainly medication management. So the sooner someone comes in, the greater the opportunity it gives us to give them as full a recovery as possible.
Absolutely, Dr. Ferdue, really good advice, and thank you again. May is Stroke Awareness Month, so keep that in mind, and thank you for being here.
Thank you for having me.